Abnormal psychology refers to the branch of psychology that focuses on the study of abnormal behavior and mental disorders. It involves understanding and explaining abnormal thoughts, feelings, and behaviors that deviate from the norms of a society or culture. Abnormal psychology aims to identify, understand, and treat psychological disorders using various theoretical perspectives, research methods, and diagnostic frameworks. The study of abnormal psychology involves several key components, including 1. Diagnosis. Abnormal psychology seeks to establish a systematic approach to diagnosing psychological disorders. Diagnostic and Statistical Manual of Mental Disorders (DSM-5) is commonly used by mental health professionals to classify and categorize different psychological disorders based on a set of symptoms, behaviors, and characteristics. 2. Assessment. This involves the evaluation and measurement of various psychological factors and symptoms to determine the presence and severity of a disorder. Assessment methods may include interviews, psychological tests, and observations. 3. Causes and risk factors. Abnormal psychology investigates the underlying causes and risk factors that contribute to the development of psychological disorders. These factors can include biological, genetic, environmental, and social influences. 4. Treatment and intervention. Abnormal psychology focuses on developing effective therapies and interventions to alleviate symptoms, improve functioning, and promote overall well-being in individuals with psychological disorders. Treatment approaches can include psychotherapy, medication, behavior modification, and other evidence-based interventions. 5. Research. Research in abnormal psychology is crucial for advancing our understanding of psychological disorders, their causes, and effective treatments. Researchers conduct studies to explore new theories, evaluate treatment outcomes, and improve diagnostic tools. It's important to note that the term abnormal in abnormal psychology does not inherently imply negative or undesirable. It simply refers to behavior and experiences that deviate from what is typically considered normal within a given cultural or societal context. Abnormal psychology emphasizes the importance of cultural relativism and considers cultural, social, and individual differences when diagnosing and treating mental disorders. In conclusion, abnormal psychology is a field of study that focuses on understanding, diagnosing, and treating psychological disorders. By examining abnormal thoughts, feelings, and behaviors, professionals in this field aim to alleviate the suffering and improve the overall well-being of individuals with psychological disorders. Abnormality refers to behaviors, thoughts, or feelings that deviate from what is considered normal or typical within a particular society or cultural context. Abnormality is a concept studied within the field of psychology and involves understanding and explaining atypical behavior patterns and psychological experiences. The understanding of abnormality is essential for diagnosing and treating mental disorders and promoting psychological well-being. Key aspects of abnormality include 1. Statistical deviance. Abnormality often involves behaviors or attributes that are statistically rare within a population. If a behavior or characteristic is uncommon or occurs at an extreme level, it may be considered abnormal. For example, having extremely high intelligence or displaying highly unusual behaviors may be considered statistically deviant. 2. Dysfunction. Abnormal behavior is often associated with a dysfunction in an individual's thoughts, emotions, or behaviors. This dysfunction interferes with a person's ability to function effectively in their daily life. For instance, if someone experiences intense anxiety that impairs their ability to work or form relationships, it may be considered abnormal. 3. Subjective distress. Abnormality can also involve personal distress or discomfort. If an individual experiences significant emotional distress or discomfort due to their thoughts, feelings, or behaviors, it may be considered abnormal. This distress is subjective and can vary from person to person. 4. Violation of societal norms. Behavior that violates societal norms or cultural expectations can be considered abnormal. Societal and cultural contexts determine what is considered normal or abnormal. For example, certain cultural beliefs may perceive hearing voices as normal, while in Western cultures, it is typically viewed as abnormal. 5. Maladaptive patterns. Abnormality often involves maladaptive patterns of behavior that are harmful to oneself or others. These patterns may hinder personal growth, impair relationships, or interfere with daily functioning. Substance abuse, self-harm, or aggressive behavior are examples of maladaptive patterns associated with abnormality. It's crucial to note that abnormality is a complex construct influenced by various factors, including cultural differences, societal norms, and individual perspectives. Diagnosing abnormality requires a comprehensive assessment conducted by trained professionals using standardized diagnostic criteria, such as the Diagnostic and Statistical Manual of Mental Disorders DSM-5. Understanding abnormality is essential for identifying individuals who may benefit from psychological interventions and treatments, as well as reducing stigma surrounding mental health. By studying abnormal behavior and experiences, psychologists strive to promote psychological well-being, enhance functioning, and improve the quality of life for individuals experiencing psychological difficulties. An abortifacient is a substance or medication that is used to induce abortion or terminate a pregnancy. It is important to note that the use of abortifacients is a highly controversial and sensitive topic, as opinions on abortion vary widely and are influenced by cultural, religious, and ethical beliefs. Abortifacients can be classified into various categories based on their mechanism of action. Here are some common types. 1. Hormonal. Certain hormonal medications, such as mifepristone and misoprostol, are commonly used as abortifacients. Mifepristone, also known as the abortion pill, works by blocking the hormone progesterone, which is necessary for maintaining pregnancy. Misoprostol, often used in combination with mifepristone, causes contractions of the uterus to expel the embryo or fetus. 2. Prostaglandins. These substances, such as dinoprostone, are naturally occurring hormones that stimulate uterine contractions. When administered in high doses, they can induce labor and cause the expulsion of the embryo or fetus. 3. Intrauterine devices (IUDs). Certain types of IUDs, such as the copper IUD, can act as abortifacients by preventing implantation of a fertilized egg in the uterus. 4. Herbal remedies. Some traditional herbal remedies, such as pennyroyal and tansy, have historically been used as abortifacients. However, their effectiveness and safety are not well established and can pose serious health risks. It is crucial to emphasize that the use of abortifacients should be approached with caution and under the guidance of a medical professional. Self-administered or unsupervised use of abortifacients can lead to severe health complications, including hemorrhaging, infection, or incomplete abortion. The legality and availability of abortifacients vary across countries and regions. In some places, they may be accessible through medical professionals or clinics that offer safe and legal abortion services. In other areas, they may be prohibited or highly restricted. Discussions surrounding abortifacients often involve complex ethical, moral, and legal considerations. Opinions on the use and availability of abortifacients differ among individuals and within various cultural, religious, and political contexts. These debates often revolve around issues such as the right to access safe abortion services, the rights of the unborn, and the autonomy of the pregnant person. It is important to recognize that any discussion involving abortifacients should be approached with sensitivity and respect for divergent viewpoints. Open dialogue, informed by evidence-based research and compassionate understanding, can help foster a better understanding of this complex topic. Abortion is the medical or surgical termination of a pregnancy, resulting in the removal or expulsion of the embryo or fetus from the uterus. This procedure can be performed for various reasons, including medical, social, or personal factors. Abortion is a complex and highly debated topic worldwide. It raises significant ethical, moral, and legal questions, as opinions on abortion vary widely and are influenced by cultural, religious, and personal beliefs. Here are some important points to consider when discussing abortion. 1. Legal status. The legality of abortion differs across countries and regions. Some countries have laws that permit and regulate abortion, while others prohibit or restrict it. The legal framework often considers factors such as gestational age, the reason for the abortion, and the health and life of the mother. 2. Methods. Abortions can be performed through medical or surgical procedures. Medical abortion involves the use of medications, such as mifepristone and misoprostol, to induce the termination of pregnancy. Surgical abortion typically involves procedures like suction aspiration or dilation and curettage D&C, which remove the embryo or fetus from the uterus. 3. Gestational age. The gestational age of the pregnancy plays a crucial role in determining the available methods and legal restrictions for abortion. Early abortions, usually within the first trimester, up to 12 to 14 weeks, are generally considered safer and more accessible. Late-term abortions, typically after the first trimester, are subject to more stringent regulations and may only be performed in certain situations, such as when the mother's life is in danger or when severe fetal abnormalities are detected. 4. Health considerations. In some cases, abortion may be necessary for medical reasons. If the continuation of the pregnancy poses a significant risk to the mother's health or life, or if there are severe fetal abnormalities, medical professionals may recommend or perform an abortion. These situations often involve careful and ethical decision-making in consultation with the pregnant individual and their healthcare team. 5. Emotional and psychological impact. Abortion can have emotional and psychological effects on individuals who undergo the procedure. Some individuals may experience feelings of relief or empowerment, while others may feel sadness, grief, or a range of other emotions. It is important to provide support and access to counseling services for those who may need it. 6. Access and barriers. Access to safe and legal abortion services varies globally. Socioeconomic factors, legal restrictions, cultural norms, and stigma can act as barriers to accessing safe and timely abortions. Limited access to affordable healthcare, contraception, and comprehensive sex education can contribute to situations where individuals may feel they have no choice but to seek unsafe abortion methods. It is crucial to approach discussions about abortion with compassion and respect for diverse viewpoints. Recognizing the complexity of the issue and the personal experiences of individuals involved is essential. Promoting comprehensive reproductive health care, including access to contraception and family planning services, can help reduce the need for abortions and promote reproductive autonomy and well-being. Abortion laws refer to the legal regulations governing the practice of abortion, which is the termination of a pregnancy. These laws vary widely from country to country and may be influenced by cultural, religious, and socio-political factors. The status of abortion, whether it is permitted, restricted, or prohibited, has been a subject of intense debate and controversy worldwide. Abortion laws can be categorized into different frameworks. 1. Permissive laws. These laws allow abortion without significant restrictions. They generally include provisions for safe and legal access to abortion services. Countries such as Canada, Netherlands, and Uruguay have permissive laws that uphold a woman's right to choose whether to have an abortion. 2. Restrictive laws. These laws place limitations and conditions on the availability of abortion. They usually require specific justifications, such as risks to the mother's life or health, fetal abnormalities, or rape and incest. Many countries, including the United States, Germany, and Japan, have restrictive laws that vary in their stringency and requirements. 3. Prohibitive laws. These laws criminalize abortion in most or all circumstances. They do not typically make exceptions, even for cases of rape, incest, or risks to the mother's life. Some countries with prohibitive laws include Chile, El Salvador, and Nicaragua. In these settings, individuals seeking abortions may resort to unsafe and clandestine procedures, which can have serious health consequences. The legal frameworks surrounding abortion are influenced by various factors. 1. Constitutional rights. Some countries recognize the right to privacy or bodily autonomy, which can encompass the right to access safe and legal abortion services. The interpretation of constitutional rights can shape the development and implementation of abortion laws. 2. Religious and cultural beliefs. Religiously conservative societies may have restrictive or prohibitive laws influenced by religious doctrines. For example, countries with a strong Catholic influence, such as Ireland and Poland, historically had strict laws before recent reforms. 3. Public opinion and activism. Public attitudes towards abortion play a significant role in shaping laws. Activism from both pro-choice and pro-life movements can influence legislation and policy debates. Public opinion surveys and pressure from advocacy groups often impact legal reforms. 4. International human rights standards. International treaties and conventions, such as the International Covenant on Civil and Political Rights and the Convention on the Elimination of All Forms of Discrimination Against Women, provide a framework for understanding abortion rights as part of reproductive health and women's rights. These standards can influence domestic law and court decisions. It is important to note that abortion laws and regulations are constantly evolving and can vary within regions and jurisdictions even within the same country. Some countries have recently undergone significant changes in their abortion laws based on shifting societal values, advances in medical technologies, and advocacy efforts. Understanding the complexities of abortion laws requires examining the legal, political, and social contexts in which they are situated. It involves considering issues of women's rights, reproductive health, medical ethics, human rights, and the broader cultural and moral debates surrounding pregnancy termination. Aboulia is a neurological disorder characterized by a lack of willpower or motivation, resulting in a significant loss or impairment of voluntary actions and decision-making abilities. It is often accompanied by a diminished emotional response and a passive and apathetic demeanor. Aboulia is considered a rare condition and is primarily associated with damage or dysfunction in the brain's frontal lobe, basal ganglia, or thalamus. The term, aboulia, comes from the Greek words, meaning without, and boul, meaning will or intention. Individuals with aboulia may experience difficulties initiating or completing tasks, making decisions, and experiencing emotions. They may have trouble organizing their thoughts, expressing themselves, and showing enthusiasm or initiative. The causes of aboulia can vary and may include 1. Brain injuries. Traumatic brain injuries, strokes, brain tumors, or infections can damage specific areas of the brain responsible for the regulation of willpower and motivation, leading to aboulia. 2. Neurological disorders. Certain neurological conditions, such as Parkinson's disease, Alzheimer's disease, or Huntington's disease, can manifest aboulia as a symptom due to the degeneration or dysfunction of brain structures involved in motivation and decision-making. 3. Psychiatric disorders. Aboulia can also be seen in individuals with psychiatric disorders, including major depressive disorder, schizophrenia, or certain personality disorders. It can be a manifestation of their underlying mental health condition. Diagnosing aboulia involves a comprehensive evaluation by a healthcare professional, including a thorough medical history, physical examination, and neuroimaging tests like magnetic resonance imaging (MRI) or computed tomography (CT) scans. Assessment of willpower, motivation, decision-making abilities, and emotional responsiveness is conducted to differentiate aboulia from other related conditions. Treating aboulia can be challenging, and the primary focus is on addressing the underlying cause or condition contributing to the symptoms. The treatment approach may involve a combination of medication, psychotherapy, and rehabilitation therapies like physical, occupational, and speech therapy. Medications such as selective serotonin reuptake inhibitors (SSRIs) or dopamine agonists may be prescribed to target specific neurotransmitter imbalances or deficiencies. Psychotherapy can help individuals with aboulia develop compensatory strategies, improve motivation, and regain a sense of purpose. Cognitive behavioral therapy (CBT) may be beneficial in building goal-setting skills, enhancing decision-making abilities, and managing negative thoughts and emotions. In some cases, rehabilitation therapies can help individuals with aboulia regain lost physical and cognitive abilities. These therapies may include exercises to improve motor function, cognitive rehabilitation exercises, and vocational or occupational training to enhance daily living skills and productivity. It is worth noting that aboulia can have a significant impact on an individual's quality of life, relationships, and daily functioning. Support from family, friends, and healthcare professionals is crucial in providing a supportive environment, fostering motivation, and offering assistance with daily tasks. Overall, aboulia is a complex neurological disorder characterized by a lack of willpower, motivation, and decision-making abilities. Understanding its causes, symptoms, and available treatment options can help individuals and their caregivers manage the condition and improve their overall well-being. The above-average effect, also known as the superiority bias or better-than-average effect, is a cognitive bias in which individuals tend to overestimate their abilities or qualities in comparison to others. This bias leads people to believe that they are better than the average person in various domains such as intelligence, attractiveness, driving skills, or likelihood of success. The above-average effect was first identified by social psychologists, who conducted studies to assess people's self-perceptions and beliefs about their own abilities. These studies consistently showed that a significant majority of individuals rate themselves as better than average, regardless of the specific trait being evaluated. There are several factors that contribute to the prevalence of the above-average effect. One primary factor is the inherent need for maintaining positive self-esteem. The belief that one is above average serves as a self-protective mechanism, boosting self-confidence and providing a sense of superiority. People tend to compare themselves to others who are perceived as less capable or successful to maintain this positive self-image. Social comparison also plays a role in the above-average effect. When individuals compare themselves to others, they tend to choose individuals who they perceive as less skillful or accomplished in a particular domain. This selective comparison reinforces the belief that they are better than average. Another factor that contributes to the above-average effect is the perception of personal uniqueness. People often emphasize their unique qualities and downplay or ignore the abilities and achievements of others, leading to an inflated self-assessment. The above-average effect has implications in various areas of life. In academic settings, students may overestimate their academic performance, which can lead to unrealistic expectations and poor study habits. In professional settings, employees may overestimate their skills, leading to overconfidence and decreased motivation to improve. This bias can also impact decision-making processes, as individuals may rely on their inflated self-perceptions rather than seeking out accurate information or advice from others. Although the above-average effect is a common cognitive bias, there can be individual and cultural differences in its manifestation. Some studies have found that individuals with low self-esteem may not exhibit this bias, while those with high levels of confidence and self-assuredness are more likely to display it. Recognizing the presence of the above-average effect is important to promote self-awareness and accurate self-assessment. Encouraging individuals to seek feedback from others, engage in objective self-evaluation, and consider multiple perspectives can help mitigate the impact of this bias. Additionally, promoting a culture of collaboration and teamwork rather than fostering excessive competition can help individuals develop a more realistic perspective of their abilities and achievements. In conclusion, the above-average effect is a cognitive bias in which individuals tend to overestimate their abilities or qualities in comparison to others. Factors such as the need for positive self-esteem, selective social comparison, and the perception of personal uniqueness contribute to this bias. Recognizing its presence and promoting accurate self-assessment can help individuals develop a more realistic perception of their capabilities and improve decision-making processes. Abreaction is a concept in psychology that refers to the emotional release or discharge of repressed feelings or traumatic experiences. It is a therapeutic technique used to help individuals confront and process unresolved emotions or memories that have been stored in their unconscious mind. Through abreaction, individuals are able to release pent-up emotions, gain insight into their experiences, and ultimately achieve emotional healing and growth. Abreaction is often utilized in psychotherapy sessions, particularly in approaches such as psychodynamic therapy or trauma-focused therapy. The process involves creating a safe and supportive environment where individuals feel comfortable expressing their emotions and exploring their past experiences. The therapist guides the client through the abreaction process, ensuring that they are able to fully experience and express their emotions without becoming overwhelmed. The term, abreaction, was first introduced by Sigmund Freud, the pioneer of psychoanalysis. Freud believed that repressed emotions or traumatic memories could exert a powerful influence on an individual's thoughts, behaviors, and overall mental health. He suggested that when these repressed materials are brought into conscious awareness through abreaction, they can be processed and integrated, leading to psychological healing. During an abreaction, individuals may experience intense emotions such as anger, fear, sadness, or even joy. These emotions are often accompanied by physical responses such as crying, shouting, trembling, or vivid bodily sensations. The goal of the therapeutic process is not only to release these emotions but also to provide an opportunity for individuals to gain insight, make connections between past and present experiences, and develop a new understanding of themselves and their emotions. Abreaction can be particularly helpful in addressing unresolved trauma. Traumatic experiences can leave a lasting impact on individuals, leading to symptoms such as anxiety, depression, flashbacks, nightmares, and hypervigilance. By engaging in abreaction, individuals are able to revisit and process these traumatic memories, allowing for emotional release and a reduction in symptoms. This process is often gradual and requires a trusting therapeutic relationship, as individuals need to feel safe and supported in exploring their most vulnerable experiences. It is important to note that abreaction should only be conducted under the guidance of trained and experienced therapists. The therapist helps individuals manage their emotions and provides support throughout the process. They also employ various techniques and interventions to help individuals regulate their emotions and ensure they do not become overwhelmed or re-traumatized during the abreaction. In summary, abreaction is a therapeutic technique used in psychology to facilitate the emotional release and processing of repressed feelings or traumatic experiences. It involves creating a safe and supportive environment for individuals to express and explore their emotions. Through abreaction, individuals can release pent-up emotions, gain insight into their experiences, and achieve emotional healing and growth. It is important that abreaction is conducted by trained therapists who can guide individuals through the process and provide the necessary support and interventions. Abscess is a medical condition that involves the formation of a pocket of pus within body tissues. It typically occurs as a result of a bacterial infection, often caused by the introduction of bacteria through a break in the skin or from an underlying infection. Abscesses can develop in various body parts, including the skin, organs, and deep tissues. When bacteria enter a wound or an area of tissue damage, the body's immune system responds by sending white blood cells to the site to combat the infection. As white blood cells fight off the bacteria, dead tissue and other debris accumulate, leading to the formation of pus. Pus consists of dead cells, bacteria, and tissue fluid, and it is contained within a cavity that seals off the infection to prevent it from spreading. Symptoms of an abscess may include swelling, redness, pain, and warmth in the affected area. As the abscess grows and fills with pus, it can become increasingly tender and painful. If the abscess is near the surface of the skin, it may eventually form a visible swollen lump or a head that can be felt or seen. In some cases, abscesses may cause systemic symptoms such as fever, chills, and fatigue. Treatment for an abscess typically involves draining the pus and eliminating the underlying infection. In some cases, this can be done through a simple procedure known as incision and drainage. During this procedure, a healthcare professional will make a small incision in the abscess, allowing the pus to drain out. After the drainage, the wound is usually cleaned, and in some cases, antibiotics may be prescribed to help clear the infection. In more complex cases, such as deep or internal abscesses, surgical intervention may be necessary. This may involve making a larger incision or using imaging techniques to guide the drainage procedure. In certain situations, catheters or other devices may be inserted to facilitate continued drainage of the abscess, particularly if it is difficult to access or if there is a risk of reaccumulation of pus. After the drainage or surgical intervention, it is important to keep the affected area clean and properly bandaged to prevent further infection. Antibiotics may be prescribed in cases of severe infection or if the abscess is near important structures or organs. If left untreated, abscesses can lead to serious complications, such as the spread of infection to nearby tissues or organs, the formation of a fistula, an abnormal connection between organs or tissues, or the formation of a chronic abscess that does not heal properly. In rare cases, abscesses can also lead to the development of bacteria in the bloodstream, causing a condition known as sepsis, which can be life-threatening if not treated promptly. In summary, an abscess is a pocket of pus that forms as a result of a bacterial infection. It is characterized by swelling, redness, pain, and the accumulation of pus. Treatment typically involves draining the abscess and addressing the underlying infection. Prompt medical attention is important to prevent complications and promote healing. Abscissa is a mathematical term used in the field of coordinate geometry. It refers to the horizontal coordinate of a point on a graph or a coordinate plane. In other words, the abscissa is the x-coordinate that helps determine the position of a point on the x-axis. In Cartesian coordinate systems, which are commonly used to represent points in two dimensions, the x-axis is the horizontal line that extends in both positive and negative directions. The abscissa is measured along this x-axis, usually from a reference point called the origin. The origin is typically denoted as 0, 0, where the abscissa is 0. To illustrate this, imagine a graph with a horizontal x-axis and a vertical y-axis. Each point on this graph has an ordered pair x, y, where x represents the abscissa and y represents the ordinate, the vertical coordinate or y coordinate. The abscissa tells us how far to the right positive direction, or left negative direction, a point is from the origin. For example, consider the point 3, 2. The abscissa 3 tells us that the point is located 3 units to the right of the origin, while the ordinate 2 indicates that the point is located 2 units above the x-axis. The abscissa is an essential component in graphing functions and analyzing data. It helps visualize relationships between different variables and enables the representation of mathematical models and equations. By plotting points and connecting them with lines or curves, the abscissa allows for the representation of various mathematical concepts, such as linear equations, quadratic functions, and more complex mathematical functions. In addition to its significance in the Cartesian coordinate system, the concept of abscissa also extends to other coordinate systems, such as polar coordinates. In polar coordinates, a point is represented by an ordered pair r, theta, where r denotes the distance from the origin and theta represents the angle formed between the positive x-axis and the line connecting the origin and the point. In this case, the abscissa corresponds to r times cos theta, indicating the x-coordinate of a point in the polar coordinate system. In summary, the abscissa is the x-coordinate of a point on a graph or coordinate plane. It determines the horizontal position of a point and is measured along the x-axis, usually from the origin. Understanding the abscissa is crucial for visualizing and analyzing mathematical functions and data in coordinate geometry. In the field of psychology, absence can refer to a variety of phenomena related to mental health and cognition. Here is an in-depth explanation. 1. Absent-mindedness. Absent-mindedness is a common phenomenon where a person is unaware of their surroundings or forgetful about certain actions and events. This can happen due to various reasons, such as sleep deprivation, stress, or age-related changes in memory. 2. Absence seizures. Absence seizures, also known as petit mal seizures, are a type of seizure that affects consciousness. These seizures can happen suddenly and last for a few seconds. During this time, the person may appear to be staring off into space, unresponsive, or disconnected from their surroundings. 3. Dissociative disorders. Dissociative disorders are a group of mental health conditions that involve a disconnection or separation between a person's thoughts, feelings, memories, and actions. Examples include dissociative identity disorder, dissociative amnesia, and depersonalization derealization disorder. These conditions can result in a sense of absence or detachment from one's self or reality. 4. Learning and memory. In the context of learning and memory, absence can refer to a lack or gap in one's recall of information or skills. For instance, a person might experience an absence of knowledge if they have forgotten an important fact or concept. Similarly, if a person is unable to perform a previously learned skill, they might experience an absence of ability. 5. Deprivation. Deprivation can lead to feelings of absence or lack. For instance, if a person is deprived of social connection, they might experience a sense of absence or emptiness in their lives. Similarly, deprivation of basic needs such as food, water, or sleep can result in a physical and emotional sense of absence. Overall, absence, in psychology can refer to a range of phenomena related to cognition, perception, and mental health. These include absent-mindedness, absence seizures, dissociative disorders, learning and memory, and deprivation. Understanding these concepts can help psychologists and mental health professionals diagnose and treat various conditions that affect human behavior and mental states. The term, absence culture, does not have a widely recognized definition or specific meaning in the field of cultural studies or social sciences. However, based on the interpretation of the words absence and culture, we can explore a possible explanation. 1. Absence. Absence refers to the state of being away or not present. In the context of culture, absence can imply a lack of certain elements, characteristics, or behaviors within a particular cultural group or community. 2. Culture. Culture encompasses the shared beliefs, values, customs, practices, and behaviors that characterize a particular group of people. It includes visible and invisible aspects of social life, such as language, traditions, art, norms, and attitudes. Bringing these two concepts together, absence culture could potentially refer to a cultural environment or group that is characterized by the absence or lack of certain cultural elements customarily associated with that group. This absence might manifest in various ways. 1. Absence of cultural traditions. In a rapidly changing society or within communities undergoing significant transformations, the younger generations may distance themselves from traditional cultural practices, resulting in an absence of these traditions. This can occur due to factors such as globalization, migration, urbanization, or the influence of mainstream culture. 2. Absence of cultural representation. Within a broader society, certain cultural groups or communities may experience a lack of representation in media, arts, literature, or politics. This absence may lead to feelings of marginalization, erasure, or underrepresentation, resulting in the emergence of an absence culture that struggles to have its voice and identity recognized. 3. Absence of cultural values. Cultural values, such as respect for elders, filial piety, or collective harmony, may diminish or be less emphasized within specific cultural contexts. This absence of traditional values can occur due to generational shifts, lifestyle changes, or the adoption of new cultural values influenced by external factors. 4. Absence of cultural practices. Certain cultural practices, rituals, or ceremonies may decline or disappear over time. This absence can result from changing socio-economic conditions, modernization, or acculturation, leading to a cultural landscape that is devoid of these practices. It is important to note that the term, absence culture, can vary in meaning and interpretation depending on the context and specific cultural group being discussed. It may also carry different implications or ramifications for different individuals within that culture. In conclusion, the term, absence culture, implies a situation where certain cultural elements or practices are lacking or diminishing within a specific cultural group or community. Whether it refers to the absence of traditions, representation, values, or practices, further exploration and examination of the specific cultural context is necessary to fully understand and analyze the concept of absence culture. Absence seizures, also known as petit mal seizures, are a type of seizure disorder characterized by brief, sudden lapses of consciousness that occur frequently throughout the day. These seizures typically begin in childhood and can continue into adulthood, although they tend to decrease in frequency and severity over time. During an absence seizure, the person may appear to be staring blankly into space with a vacant expression on their face. They may also exhibit automatic movements, such as lip smacking, chewing, or hand wringing. The seizure usually lasts for 10 to 20 seconds and ends abruptly, with the person returning to their normal level of consciousness without any memory of the seizure. The exact cause of absence seizures is not fully understood, but it is believed to be related to a temporary abnormality in the electrical activity of the brain. This abnormality may be triggered by various factors, such as sleep deprivation, emotional stress, or flashing lights. There are several different types of absence seizures, including typical absences and atypical absences. Typical absences are the most common type of absence seizure and usually occur in children between the ages of 4 and 14. They are characterized by a sudden loss of consciousness and a blank stare that lasts for a few seconds. Atypical absences, on the other hand, last longer and are more subtle in nature. They may involve mild confusion or a slow return to consciousness after the seizure ends. Atypical absences are more common in children with developmental disorders, such as autism. The diagnosis of absence seizures is typically based on a combination of medical history, physical examination, and neuroimaging tests. An electroencephalogram (EEG) may also be used to measure the electrical activity of the brain and identify any abnormalities that may be indicative of a seizure disorder. Treatment for absence seizures typically involves medications that help to control the abnormal electrical activity in the brain. The most commonly used drugs include valproic acid, ethosuximide, and lamotrigine. In some cases, surgery may be recommended to remove the portion of the brain responsible for the seizures. Overall, while absence seizures can be disruptive and alarming, they are generally not life-threatening and can be effectively managed with appropriate treatment and support. Absence without leave (AWOL) refers to a situation where a person is absent from their designated place of duty or responsibility without obtaining the necessary permission or authorization. This term is commonly used in military, employment, and educational contexts. In the military, AWOL refers to a situation where a service member is absent from their assigned duty station or fails to report for duty without proper authorization. This is considered a serious offense and can lead to disciplinary action, including formal charges, loss of pay, reduction in rank, and even court-martial depending on the circumstances and frequency of the absences. In an employment setting, AWOL refers to instances where an employee is absent from work without notifying their employer or without obtaining prior approval. This can result in consequences such as reprimands, loss of pay, termination of employment, and a negative impact on the employee's professional reputation. In an educational context, AWOL refers to students who are absent from school or classes without a valid reason or without notifying the school administration. Continuous unexcused absences can lead to academic consequences, such as lower grades, disciplinary actions, and even expulsion. AWOL can occur for various reasons, including personal emergencies, family issues, illness, lack of motivation, dissatisfaction with the job or school, and other personal circumstances. However, regardless of the reason, being AWOL is generally seen as a breach of responsibility and a violation of the established rules and procedures. To address the issue of AWOL, organizations typically have policies and procedures in place that outline the appropriate steps to follow when requesting leave or reporting absences. These policies may require employees or service members to inform their supervisors or chain of command as soon as possible, provide valid reasons for their absence, and present any necessary documentation to support their request. It is important to note that while some absences might be excused or justified, repeated or unexplained instances of being AWOL can have serious consequences and may damage an individual's professional or academic progress. In conclusion, AWOL refers to being absent without proper permission or authorization from a designated duty or responsibility. It carries serious ramifications in military, employment, and educational contexts and is generally viewed as a breach of responsibility. Organizations have specific policies in place to handle AWOL incidents, and repeated instances of being AWOL can negatively impact an individual's professional or academic standing. Absent grief is a term used in the context of the grieving process. This term refers to an experience where an individual does not show any signs or react emotionally to their loss. In a healthy grieving process, a person usually experiences intense feelings such as deep sadness, loss, confusion, anger, and emptiness. However, in the case of absent grief, the individual may not feel or express these emotions in the expected way. Generally, there are several factors that can contribute to absent grief. One possible factor is the way an individual manages their emotions, where they may feel uncomfortable expressing or confronting the pain they feel from losing a loved one. This can occur due to unconscious emotional denial or avoidance, or because the person is trying to protect themselves from deep pain. Additionally, there are other factors that can influence absent grief, such as past traumatic experiences, other emotional or psychological disorders, or cultural and environmental influences. For example, in some cultures or families, there may be expectations to remain strong or withhold open emotional expression. Absent grief can have varying consequences depending on the individual and the situation involved. Some people may feel like they have hidden or suppressed their emotions, which may resurface at a later time with greater intensity. It is important to remember that individuals experiencing absent grief still have the right to process their sadness in ways that are appropriate for them. For those around individuals experiencing absent grief, it can be challenging or confusing to interact with them. It may feel like the individual is not acknowledging or displaying normal levels of sadness. It is important for family and friends to try to understand that everyone reacts differently to loss in the grieving process, and to respect the individual's way of coping with the situation. It is important to note that absent grief does not always mean that someone is not experiencing sadness or loss. They may be privately and silently grieving, or their way of dealing with sadness may not be externally visible. In many cases, it is highly recommended to seek support and assistance from mental health professionals or qualified therapists to help break the pattern of absent grief and manage the associated pain of the loss. Absent state is a psychological term used to describe a mental state in which an individual feels disconnected from their surroundings and experiences a sense of detachment and numbness. It is often associated with conditions such as dissociation, depersonalization, and derealization. In an absent state, a person may feel like they are not totally present in their body, and reality may seem unreal or distorted. They may feel detached from their thoughts, emotions, and actions, as if they were watching from the outside. This can lead to difficulty functioning in daily life due to the lack of connection with one's surroundings. There are several factors that can contribute to an absent state. One possible cause is trauma or intense stress, where the mind may dissociate as a coping mechanism to shield itself from the distress. Other potential causes can include anxiety, depression, substance abuse, and various mental health disorders. Symptoms of an absent state may include a sense of disconnection from oneself, others, or surroundings, feelings of detachment or numbness, distorted perceptions of time and space, and difficulties with memory and concentration. These symptoms may vary in intensity and duration, and may affect daily functioning. Individuals experiencing an absent state may feel like they are losing control or going insane, which can be highly distressing and may increase anxiety. They may also feel ashamed or embarrassed to talk about their experiences, as they may worry about being perceived as abnormal or weak. Treatment for an absent state may include therapy, medication, and other supportive interventions. Therapy can help individuals understand and process the underlying causes of their dissociation, develop coping skills to manage stress and emotions, and improve their connection with themselves and others. Medications may be recommended to reduce symptoms such as anxiety and depression. It is important to seek professional help if an absent state interferes with daily functioning or causes distress. Additionally, family and friends of those experiencing an absent state can provide support by listening without judgment, offering reassurance and encouragement, and encouraging professional help when needed. With appropriate support and treatment, individuals experiencing an absent state can regain a sense of connection with themselves and their surroundings. Here is our explanation of the material. Click like if this video is helpful. Support our channel by subscribing. Thank you.